Local hospitals making a major announcement today that Accelerated Urgent Care will take 10,000 square feet and turn it into a COVID-19 testing facility. We do have a live look at a news conference happening right now. We do want to take a moment and listen in.
You know, this isn't a money-making venture, but we have to cover the costs so we can keep our doors open. That's the key.
Are you concerned that people might be turned away once they find out that you typically need health care to afford something like this, or once they hear that there will be a copay?
I don't think so, because what I would say is it's important to diagnose this on the front end and isolate, because the cost of not diagnosing this and then taking it to a hospital or a loved one that causes them significant illness is worth thousands of dollars. So I think a little bit of upfront cost would actually save a lot of back-end costs. I think that's how I would look at it.
You know, a lot of people right now, they have symptoms and they want to be tested, but they're being turned away because of their travel history. Will this make it more accessible? Will this lower the necessary barrier for those who are allowed to be tested?
Well, exactly, and there's a little bit of panic. You got to remember, coronavirus has been around since the 70s, right? Coronavirus causes a flu-like illness. So you take the same precautions and concern. My staff takes the same precautions and concern as a flu patient, because you get a flu-like illness. And so I think people have to sort of keep a rational mind about this and realize that even if you get coronavirus, you're going to have a flu-like illness that most of the time is going to resolve. If you're 85 years old and you've got multiple medical problems, it's going to cause more of a significant event. You know, if you're a young, otherwise healthy person, you get coronavirus, you're going to get a flu-like illness that's going to likely resolve on its own.
Can you talk a little bit about this facility and how you guys are going to facilitate this? I mean, obviously here you're lucky that you have this new wing that looks like it's just about to be completed, but but you tell us that. How are you guys making this work? How is Accelerated able to facilitate this venture?
Well, communication is a big deal. So we've communicated with all major hospitals and said, listen, we know you guys don't want coronavirus. So we're setting aside, we're converting our brand new space into a COVID testing center that has a private entrance, has testing that won't be exposed to our general population, and is central to the city, so that whether you're at Mercy Southwest, they might say, hey, go over to Accelerated to the COVID testing. We don't want it in the hospital. Or if you're at your primary care doc, he's only got 2 tests and he has 10 patients that want it. We're attempting to stockpile a lot of testing here in a centralized location, and we have the staff available. So a lot of small facilities don't have 50 doctors to pick from. We can pull in our doctors and our staff so we can see a pretty high volume of patients.
At this particular facility, not at the other facilities, at this facility.
I just want to stress my question again. I don't think it was answered. Do you have to have a travel history in order to get coronavirus testing?
No. The rules have changed over the last 2 days. They used to have a long criteria that you had to meet in order to get testing. Then they said, we'll leave it up to your doctor. And then they said, we want people to be tested that want to be tested. So it's evolved. I was telling my staff, they're like, it keeps changing. I said, it does keep changing. And so if you ask me tomorrow, it may be different again. But for right now, if we're listening to the president and the public health department and the CDC, and they're saying, if the physician thinks it's necessary, let's do it. If the patient really wants to be tested, for instance, if a patient has a grandmother at home with congestive heart failure, 85 years old, she wants to know, I need to separate. I need to maintain a 6-foot distance from grandma so I don't give it to her. And I have to say, President Trump did an amazing job of stopping travel early. He got tons of heat for that. And for me, I applaud that, because before, he had the foresight to look and say, let's stop this before it gets out of hand. Because if you just keep that travel coming, an airplane is a big petri dish. Everybody's breathing and getting infected. They drop everybody off. Their symptoms don't show up for 2 weeks. Then we would have massive outbreak. He controlled that. So I think he's done a great job so far.
So at the end of the day, the message is, if you have symptoms, stay home or come here. Don't go anywhere else.
Yeah, and the big message is, make sure you get seen. Because what we don't want to do is someone says, oh, I just have a cold, or I just have something, when they really have pneumonia. You need to be seen by a physician, listens to your lungs, does the testing, and says, okay, you have a common cold. That's important to know. Because sometimes we'll find people say, oh, I just have a cold, and we do a chest x-ray and they have a huge pneumonia. Pneumonia only doesn't kill you because we have antibiotics. So it's important when you're ill, and you're having a fever and you're not sure what's going on, get a medical professional to check you. We'll screen you and make sure it's nothing that you need either antibiotics or antivirals for.
And we're in flu season.
Yeah, we're in flu season, so we're still seeing a lot of flu, and we're going to test you for flu. If the flu's positive, we don't check for corona, because the flu virus is what's causing your symptoms. So we don't check for everything when you come in here. We don't shotgun it. We just test for flu before the coronavirus, because if you have influenza A and B and you have flu symptoms, it's from the influenza.
And so is there a number that people should call to set up an appointment, let's say, to get testing first, or can they just walk in?
They can just walk in. Yeah, if you go to acceleratedurgentcare.com, we have something called a Zip Pass. People can jump on there as an appointment based. However, this is a separate clinic. Like this is called 212 Coffee, this location. If you go on our website right now, you'll see a Zip Pass. You can click on there, put in your information, and I can see on my phone that you just checked in as an appointment. This center is different because it's separate. So we're really doing kind of a show up and be seen kind of model, so that people don't have to have an appointment, because we kind of anticipate some backup. So if someone has an appointment but we have 18 people ahead of you who have been waiting, it doesn't work as well as say the urgent care does, where we're planning for people to come in.
I think it's also important to mention this facility will not be available until early next week. So please go to the website, go to our social media to make sure it is up and running, or call.
Yeah, if you call the 212 Coffee site, if you go to our website, all the phone numbers are there for 212 Coffee. If people call, our staff will keep them abreast of when we're going to open, because we don't want people coming before we're open, and we don't want to open before we're ready to do all the viral testing. Because a scenario we don't want is everybody showing up before we have enough COVID testing, because then that frustrates people. They come, they wait, and we can't test them. So we want to make sure we're actually getting some of the supplies from Kern Medical and Memorial San Joaquin, so that we have the tests here that people are needing.
All right, and you